Welcome to Chapter 8, Interventions. This chapter marks a turning point in the planning process, translating theory and evidence into real action. Now that we've assessed needs, set goals and objectives, and selected appropriate theories or models, it's time to design the actual intervention. Let's begin with the definition. An intervention is a set of planned activities or strategies designed to achieve the stated program goals and objectives by addressing identified needs. Interventions can change behavior, shift environments, influence policies, or improve access to resources. First is, effective interventions must be intentional. Every activity should link directly to a goal or objective. Second is, they should be theory-based, grounded in behavior change science. Third is, they must be evidence-informed and context-specific. Fourth is, successful interventions are developed with cultural sensitivity, health literacy, and stakeholder input in mind. Public Health 3.0 and systems thinking interventions today operate within a systems framework aligned with the Public Health 3.0 movement. This perspective recognizes that health outcomes are shaped by complex, interconnected systems, not just individual behavior. First is Public Health 3.0 calls for cross-sector collaboration. Second is it focuses on addressing upstream social determinants of health. Third is it emphasizes health equity, multi-sectoral leadership, and innovation. This means we must design interventions that address wicked problems like poverty, racism, and food insecurity, which cannot be solved by health educators alone. Using logic models to guide intervention design, logic models are powerful visual tools that show how a program is expected to work. They clarify the chain of inputs, activities, and outcomes. A strong logic model includes: first is inputs, resources used to operate the program, for example, funding, staff, materials. Second is activities, the interventions you'll implement. Third is outputs, direct products of activities, for example, number of classes held. Fourth is outcomes, short-term, intermediate, and long-term effects. This if-then structure helps clarify assumptions, improve communication, and guide evaluation. Design thinking in public health design thinking is a human-centered, iterative process for creating meaningful, effective solutions. It includes 5 key steps. First is empathize, understand the needs, perspectives, and barriers of the target population. Second is define, articulate the specific problem you want to solve. Third is ideate, generate a wide range of creative solutions. Fourth is prototype, develop rough models or drafts. Fifth is test, gather feedback, and refine your solution. Design thinking emphasizes feedback, flexibility, and user engagement, making it ideal for tailoring interventions. 3 pathways to intervention design. When selecting or developing an intervention, planners typically follow one of 3 pathways. First is adopt, choose an existing evidence-based intervention without modification. Second is adapt, take an existing intervention and modify it for a new setting or population. Third is design, create a new intervention from scratch when no existing model fits. Each approach has trade-offs in time, cost, and required expertise. Understanding types of evidence interventions are classified by their level of evidence. First is evidence-based, supported by rigorous evaluation and peer-reviewed publications. Second is effective, supported by peer-reviewed evaluation, but not yet replicated. Third is promising, some evidence of effectiveness but limited testing. Fourth is emerging, based on practice, wisdom, or theory, with minimal formal evaluation. Use the intervention classification flowchart in Figure 8.6 to determine the right level for your program context. The Health Impact Pyramid, developed by Dr. Thomas Frieden, is a framework for prioritizing strategies based on population reach and effort. From top to bottom, first is counseling and education, impacts are narrow and require individual action. Second is clinical interventions like medication or screening. Third is long-lasting protective interventions such as vaccines. Fourth is changing the context to make healthy choices the default. Fifth is addressing socioeconomic factors, the most powerful but also the most complex. Aim for strategies that combine individual level interventions with systemic change. The 6 categories of health promotion intervention strategies. Let's walk through the 6 CDC-recognized strategy categories used in health promotion planning. 1. Health communication strategies. These involve delivering messages to inform, influence, and motivate. Channels include print and digital media, social media, email and text campaigns, public service announcements. Mobile health and apps health communication is effective when the message is credible, culturally relevant, and repeated across channels. 2. Health education strategies. These involve structured learning experiences that improve knowledge, attitudes, and skills. Examples include works, webinars, small group discussions. One on one education. School based curriculum effective education uses interactive methods and trusted facilitators. 3. Health policy enforcement strategies. These include formal or informal policies that guide behavior through incentives, mandates, or penalties. Examples: smoke free laws, school wellness policies, organizational mandates. Environmental codes and ordinances enforcement is key and must be combined with education and community buy in. 4. Environmental change strategies. These involve changing the physical, social, or economic environment to support healthy behavior. Examples: adding sidewalks or green space, offering healthier food options, changing point of sale layouts, reducing price barriers, improving lighting or signage. These strategies influence behavior by shaping default choices. 5. Health related community service strategies. These provide access to clinical or preventive services. Examples: health fairs, screenings for example blood pressure, diabetes, immunization clinics, referral systems, mobile health units. They are often combined with outreach and navigation support. 6. Community mobilization and health advocacy. These build local capacity to address health issues and advocate for change. Examples: forming coalitions or advisory boards, organizing listening sessions, community based participatory research, public hearings, social justice campaigns. Mobilization promotes sustainability and system level impact. Additional design considerations: to maximize effectiveness, your intervention must go beyond good intentions. You must design with precision and deliver with quality. Let's explore the key considerations, including best practices from Table 8.7. First is dose, the number, intensity, or duration of program contacts. Higher dose typically leads to greater effect but also requires more resources. Second is fidelity, how well the intervention is delivered as originally intended. Use staff training, manuals, and quality checks to maintain fidelity. Third is adaptation, adjust content to fit the population while preserving the core components that drive impact. Do not change essential functions, only modify form when necessary. Fourth is literacy and numeracy, use plain language and culturally appropriate content. Limit jargon, use visuals, and ensure readability at 6th, 8th grade level. Fifth is segmentation and tailoring, design for population subgroups or personalize content to individual characteristics. Use audience research, formative evaluation, and pre-testing to guide this. Sixth is interactivity, create opportunities for engagement, participation, and hands-on learning. Interactive methods improve retention and motivation. Seventh is trust and credibility, use trusted messengers, culturally competent staff, and clear branding. Trust increases uptake and compliance. Eighth is feedback and reinforcement, include mechanisms for encouragement, reminders, and progress tracking. Behavior change requires support over time. These best practices, summarized in Table 8.7, help ensure that your intervention isn't just delivered, but delivered effectively, equitably, and with lasting impact. To summarize Chapter 8, first is interventions are structured sets of activities aligned with goals and theories. Second is Public Health 3.0 calls for systems thinking and upstream approaches. Third is logic models and design thinking help create clear, user-centered programs. Fourth is planners can adapt, or design interventions depending on context. Fifth is select strategies from 6 core categories: communication, education, policy, environment, services, and advocacy. Sixth is use strong evidence, apply the health impact pyramid, and tailor with equity in mind. Thank you for watching this video. This concludes Chapter 8, Interventions, Selecting Strategies, and Designing Activities, based on planning, implementing, and evaluating health promotion programs by James McKenzie, Brad Neiger, and Rosemary Thackeray. Stay tuned for Chapter 9.